Good afternoon. Thank you so much for your patience as all of our members came from different committees and other spaces in the General Assembly. We are really excited to kick off the Social Services Subcommittee for 2025 and look forward to working with everyone to make sure that our families have the support they need to succeed. So I have a couple of administrative actions. Hold one second. Per the request of the patron, I would like a motion to go by for the day for House Bill 1596.
So moved.
And, go ahead. Sorry.
Second.
And also House Bill 1762.
So moved.
Second.
Great, thank you.
You said 1596.
Yeah, 1596 from Delegate Clark and House Bill 1762 from Delegate Moorfield. Those two will go by for the day. So we have a motion that's been properly seconded, and it's a voice vote. All those in favor say aye. Aye. Any opposed? Great. So those will hopefully be heard next week. Also, by request of the patron, House Bill 1811, we would like, our patron would like to strike that bill. Can I get a motion?
Second.
All right, all of those, that is a recorded vote, and so we'll wait for Madam Clerk for one hot moment. All right, I think she's opened the, please vote on the board. And close the roll, and so we have struck House Bill 1811. All right, I'm going to call first Delegate Cohen for House Bill 1804.
Thank you, Madam Chair and members of the committee. This bill, 1804, would direct the Department of Medical Assistance to seek the necessary approvals from the Centers for Medicare and Medicaid Services to amend its application for medical assistance to gather all the necessary information to determine an applicant's eligibility for the Medicaid Works program. This bill comes directly from the Medicaid Works work group, who worked really hard. No, I was trying to get it in 4 times, but 3 is all I'm going to be able to do. And then directly from the Disability Commission. It would just make sure that an individual, to check that an individual would be eligible for Medicaid Works when they're filling out the form, the application the first time, to see about their eligibility for Medicaid. This data is not currently collected at the time of application, and we are a Commonwealth that our participation is lower than we would like it to be, lower than we see in some other states. And so, not surprisingly, our folks with developmental disabilities want to work, and we want them to work. So this bill would not only enable more people to work, it would also help raise awareness of this incredible program of Medicaid Works, which is something that we would really like to have more people participate in. So it's my hope that the subcommittee will report this bill.
Thank you so much, Delegate Cohen. Are there any questions from our subcommittee? All right, I don't see any. Are there any folks in the audience who'd like to testify in favor of this bill? Please line up. We really appreciate you coming to take the time to share your testimony. If you can keep it brief, that would be wonderful.
Yes.
Thank you so
Madam
much.
Chair, members of the committee, I'm Terry Morgan with the Virginia Board for People with Disabilities. We are a champion of Medicaid Works. We know the opportunity that it provides people to work, earn an income, and ensure that they have the services that they need. As Delegate Cohen said, it's extremely underutilized here in Virginia, and any opportunity to promote the program, to educate people about the program, to get information out there, to really increase the people who use it would be wonderful. Thank you. Oh, and the ARC of Virginia is in another meeting right now and asked me to also share their support, so they support this bill as well.
Great, thank you so much. Good afternoon.
Good afternoon, Chair, Committee. Maureen Hollowell with Virginia Association of Centers for Independent Living, and we appreciate this being brought forward. Centers are where Medicaid work started over 20 years ago, and it has been extraordinarily slow to grow. And part of that is awareness, but a lot of it has to do with what happens at the initial eligibility process or when there's a change in eligibility. So this language of the bill will help with that, and we look forward to more people with disabilities going to work. Thank you.
Thank you so much. Are there any folks in the audience who would like to testify in opposition to this bill? All right, and I don't see anybody signed up online, correct, Madam Clerk? That's right, there's nobody else. Yes, one second, Delegate Henson. I just want to, so that folks know, if we report this bill, it would need to be to report and refer to appropriations would be the proper motion.
Move to report and refer to appropriations.
All right, the motion is to report and refer to appropriations. It's been properly seconded. Madam Clerk, if you can open the roll. Great. Thank you so much. And your bill is going to be reported and referred to the appropriations by a vote of 7-0. I'll go to full committee next. Thank you.
Thanks very much.
All right, Delegate Keys-Gamarra.
Good afternoon, Madam Chair. Is the mic on?
I think we can hear you. Yes.
Okay. Good afternoon, Madam Chair, members of the committee. It is my pleasure to bring this bill to your attention. I've had an opportunity to talk to as many folks as I possible. Basically, this is out of my experience, but it came from a member of the community who has worked extensively with the foster care population. And in the state of Virginia, while the department has a policy to try to give our foster care children suitcases, that is not necessarily always happening. And I think that the stronger approach is to have legislation that would allow our departments to focus on this and to take donations, work with nonprofits. I'm really working with the Department of Social Services to try to figure out how to reduce costs here. I did speak with them today, and they let me know of the concern because they're already working on this, but they did agree to continue to work with me regarding this. So it is my hope that we can send a very strong message to the community that our foster care children really matter, and that trash bags should be abolished unless we are disposing of items and not moving young people from one home to another. I think that this is the kind and humanizing act, and many people that I've spoken to have really offered to help gather luggages for foster care children. So I do think that we will be able to successfully minimize the costs. I've also offered with the Department of Social Services to try to remove the specific language. So there will be a substitute coming, telling them how to do it, so that they'll have the flexibility that they need to reduce those costs. I also want to mention that per the department, Maryland instituted a similar bill, and they found that they had little to no fiscal impact as a result of their efforts. So I hope it is the will of this committee to report this matter. Thank you.
Thank you so much, Delegate Keys-Gamarra. I just want to make sure I understood what you said. You anticipate that there might be changes or amendments or a substitute when we get to full committee after you are able to take into additional feedback from the department?
Yes, I had requested some language. We weren't able to pull it together in time for today's hearing.
Thank you. Are there any questions from committee members about this proposal in front of us to help our foster care kids?
Yeah, Madam Chairman.
Delegate Orrock.
Yes, if may have the patron, just quickly, so on lines 26, did the department have concerns about not being able to use bags if there's no luggage available? That was one of the things I saw. It looks like we were writing in under no circumstances could they use disposable bags unless, if they did, they had to keep a record of it. It just seemed like a lot of bureaucracy. I'm in support of the concept when the resources are available, but I don't want to create an impediment from them getting the child in a placement in a timely manner as possible. Is that something the department is working with you on for the language?
Well, I will say in my extensive conversation with the department today, they did not mention that. I did offer to remove, that's part of the how that I was saying that I would like to adjust, because I'm not trying to add a burden. I work with this department, work with the departments across several jurisdictions, and I understand how hard they work. Under no circumstances would we hold up placing a child, or would I support placing a child because we don't have luggage. But I will say, based on my conversations just in these past few weeks, numerous people have come forth to try to support this effort, so I don't think there will be a problem.
Are there any other questions for, Delegate Singh?
Thank you. Delegate, could you describe a story that you've either experienced or heard of in such a circumstance where a kid has had their belongings transported via trash bag?
Wow. I can tell you that I have gone to visit children and seen them in their foster homes where their belongings are in a trash bag. Yes. Now, one might say, do I have data to say that what impact that would have on a child? I think it stands to reason that given the traumatizing experience that a foster child has when they are removed from the only home that they probably know at the time, it certainly doesn't help.
Are there any other questions for Delegate? Delegate Henson.
Thank you, Madam Chair. This is more of a comment to the patron and to my colleague here.
Speaking to the bill.
Yes, speaking to the bill. That's what I was trying to get to. My mom is a foster mom. I know you met her, and a few people in the audience, y'all probably met some of my brothers, but a few particular brothers arrived to her home with their clothes in black trash bags. And it was disheartening to see, especially in an emergency when they do have to place children in different housing, all of their belongings in black gallon trash bags. And it brought back memories when I was sleeping on different sofas and had all my clothes in black trash bags. And the mental, it's just disheartening to see. Thank you.
Thank you so much, Delegate Henson, for sharing your story about the importance of making sure that each of us have dignity and are able to live with dignity. Delegate Walker.
Thank you, Madam Chair. A question. You did come by to speak to me yesterday, and I shared with you in my city of Lynchburg that we have a nonprofit organization that's doing the same thing as a different title, duffel bags, I think is what I shared with you here. So this is a service that's being provided in our community or in Central Virginia by a nonprofit organization. Now, when I look at this bill and it says fees, and I think if I recall, you said you didn't have any fiscal numbers at the time or any budget numbers, things like that. So I'd like to kind of have a little bit more assurance if this is going to be a cost, then how much that would be, and certainly support the service. There's no question there. But that's the one question I still have, you know.
Madam Chair, if I can just ask, I may have misunderstood what you're, I know you're concerned about the cost. Is that what you're saying?
Yes.
Okay.
In other words, fiscal, when you have in here fees, that's money. So where is that money coming from?
Fees.
To support the luggage, as you call it here.
Madam Chair, I would say to the delegate that the language in front of you is essentially a placeholder. And so I am not telling this committee that the language in front of you is the language we're going to end up with. Unfortunately, I have attempted to get some revisions, and I was not able to get that before today. But my goal is to describe the goal of providing luggage in a more general way so that local departments of social services have more flexibility on how they meet this need. and that they can work with nonprofits, they can work with corporations who may want to make donations. What I said to my promise to the department was that I wanted to remove language that they may find onerous in implementing this policy.
Okay. Thank you, Madam Chair.
Thank you. Is there a follow-up question, Delegate Orrock?
Not a question, Madam Chairman, specifically, but I was going to make a motion that we recommend passage, however, with a caveat that the patron would provide to the subcommittee members the new language before the matter would be coming before the full committee, preferably before Tuesday, so that in the event we still had concerns, the Uber chair could let the matter come back to the subcommittee for consideration. I embrace the concept, but I would feel more comfortable seeing the specific language before us before we act on it in full committee.
Okay, so I will thank you for that suggestion. Did you make that as a motion? I'm sorry. Wait, I just want to make sure we have a chance to hear if there are any folks in support too. Are there folks who are here in support of this bill? All right. Are there any folks who are here in opposition? Let's just see what number. 63.
Madam
Okay,
Chair, I
we're all
believe there
good.
may be someone online.
I don't think we have anybody signed up online for this bill. So, all right. So I think and we've done this in the past in our various HHS subcommittees where we vote kind of in concept to support an idea, and then in between subcommittee and full committee, the patron works to update the bill and then comes back and chats with us. We may end up in full committee with a different version, and that we can then vote on that version at that time. And if folks still have concerns, we can kind of figure out what are the proper next steps to that. So if that's okay with you, I think the appropriate motion would be to report and refer to appropriations. And then we will look at an updated draft at full committee on Tuesday. And I know you'll be working closely with our council to do that.
Move to report and refer to appropriations.
Second.
All right, we have a motion to report and refer to appropriations that's been properly seconded. That's before us. And Madam Clerk will open the roll. Thank you so much, Delegate Keys-Gamarra. And we'll see you in full committee on Tuesday.
Thank you, guys.
Thank you. Delegate Price?
Hello. Might we take up House Bill 1723?
Go ahead.
Okay, thank you.
So we have 1723 before us.
Yes, awesome. So, Madam Chair and members, if you'll remember, I believe it was unanimous. This body supported the establishment of the Commission to End Hunger. And we started our work July 1 of this year. And at one of our first meetings, we heard from Dr. Barrett at Cornell. And he was walking through how sometimes states have a lot of programs that are available that could assist in families not being hungry. But some of the intent doesn't always meet the people that need it because there may be roadblocks to access in different ways. And this was from birth on through to our seniors. And then as we further got into looking to see what direction the commission wanted to go into, we were finding that we needed a lot more information because, of course, hunger is a huge problem. So to better direct the efforts of the commission, we bring a unanimously supported bill, 1723, for directing the department to just kind of look into the accessibility and efficacy of the USDA programs. So those federal dollars are coming to the state. We just want to make sure that those dollars are then getting to the people. If we find that they are, then we know that there are other things that we need to work on in order to get to that ambitious goal of ending hunger. That is the gist of the bill, and I can answer any questions.
Great. Are there any questions from members of the committee on House Bill 1723? All right. Are there folks in the room who are here in support of this bill? I see folks coming up.
Good afternoon. Dana
Good afternoon.
Parsons, Vice President and Legislative Counsel with Leading Age Virginia. We represent the entire continuum of not-for-profit older adult support and services, and we support this legislation. Thank you.
Thank you.
Good afternoon, Madam Chair and members of the committee. I'm Wes Gibson with the Virginia Education Association. We strongly support this bill and strongly think that some of the greatest impact will be on our students as they're able to, we just really strongly support this bill. Thank you.
Thank you.
Madam Chair, members of the committee, Emily Moore with Voices for Virginia's Children. We also strongly support the bill. 1 in 7 children in our Commonwealth live in food insecure households, so anything that we can do to support them and their families is much needed. Thank you.
Thank you.
Good afternoon, Chair, members of the committee. Emily Hardy with the Virginia Poverty Law Center, and for the reasons stated, we also support the bill.
Thank you so much. Are there any folks in opposition to this bill or any questions from committee? All right, let me see if there's folks online for 1723. No, we don't have anybody online. All right, so this bill would also need to be referred to appropriations, so that would be the appropriate motion at this time.
Move to report and refer to appropriations.
Second.
All right, Madam Clerk, if you could please open the roll to report and refer House Bill 1723 to appropriations. Please vote on the board. Thank you so much for that. Delegate Price, your bill reports out. We'll see you in full committee for that. And now you have House Bill 1720.
Yes. So, Madam Chair, as you know, gun violence is now the #1 cause of death of children in the U.S., and day-to-day gun violence remains a serious public health crisis, hitting some communities harder than others, but with a huge financial cost to all Virginia taxpayers, estimated to be $7 billion, of which $292 million is estimated to be paid directly by Virginia taxpayers. So, House Bill 1720 shows that we can save lives and money by making certain violence prevention services reimbursable by the federally subsidized Medicaid program. An example of this kind of work that we're trying to get included would be hospital-based violence intervention programs. If you have not checked in with your local hospital, I'm sure that they have one of these programs and they are working really well. Patients are usually treated and then discharged back into some of the same conditions that led to their original victimization, and that creates a revolving door where a lot of our trauma centers are seeing some of the same patients over and over. So what these positions and programs do are to help cut down on the violent injury recidivism. And in Baltimore, for example, the participants that were involved had a recidivism rate, an injury recidivism rate of 5%, where those that were not involved had one of 36%. And then they had a yearly savings of $598,000. And of course, we would convene a work group to see, we're not Baltimore, but to see what it could do specific to Virginia. But I'll also remind you this morning, members, that I introduced the Virginia Community Violence Coalition. These are the folks that would be working with this. So we want to thank our hospitals, we want to thank our providers, our advocates, social workers, all the folks that are doing this great work. But a lot of them are doing the work out of their pocket or having to have fundraisers and bake sales in order to do this life-saving work. So we are hoping that we could get this moved forward so that they could tap into those federal dollars. And I'll leave some articles here, but Madam Chair, unfortunately, I represent an area where just this week, a teen was shot at a bus stop before school. And while that might be shocking and that might be just unconscionable, it is also the 3rd time that has happened in Newport News this academic year. So we are in a crisis. I know that we are trying to address this in many different ways, but this is a way that we could use that federal funding, not only to use solutions-based programs to help save lives, but also reduce the violence-related public costs. If you were here last year, you have already voted on this bill, so I just want to remind you to check your vote on that.
Thank you so much, Delegate Price. Are there any questions for the patron from the committee? All right. Are there folks here in support of House Bill 1720? Good afternoon.
Good afternoon. Thank you. I'll be very brief. My name is Mike McLively. I'm the Policy Director of the Gifford Center for Violence Intervention. I'm also here on behalf of the Virginia Community Violence Coalition, and I'm a board member of the Health Alliance for Violence Intervention. Just want to really urge strong support for this bill and highlight a couple of things. One is that, as Delegate Price said, when we're talking about violence intervention programs and hospital-based violence intervention, we're talking about a human-to-human approach to reducing violence. It has nothing to do with the Second Amendment. It has nothing to do with potentially infringing on Second Amendment rights, and is incredibly effective as documented through research. So this is a way to leverage federal Medicaid dollars to reimburse the life-saving work of violence prevention professionals. And Virginia is very lucky and has been very wise in intentionally investing in a number of hospital-based violence intervention programs that are doing great work across the Commonwealth. This would be another way to sustain and expand that work with the help of federal match dollars through Medicaid. So really urge your support of passing this through committee. Thank you very much.
Thank you. Good afternoon.
Good afternoon. My name is Adrian Cook. I have an organization called Let Our Voices Empower. We do violence intervention work. When I first came here, I was going to speak to something else, but I received an email, and it says Smith Elementary School. Good afternoon, Smith families. This is Mr. Blunt, the principal of Smith Elementary School. In an effort to keep our families informed, I would like to share the following information with you. Shortly after we began afternoon dismissal, an isolated situation with one individual occurred near the back of the school, close to the wooded area. We have been informed it was a self-inflicted gunshot injury. We want to assure you that there was no threat to the school or our students and staff. Due to the incident, there was a noticeable police presence in the area. Officers were on site to assist and ensure the dismissal proceeded safely and smoothly. Please know that the safety of your children and our staff members is our number one priority, and we thank you for the continued support. That was an elementary school. Like Delegate Price just talked about, we've had 3 incidents where kids have been shot, 2 killed at a bus stop. In the last 48 hours, we've had 3 teens in Newport News shot. 1 at a bus stop. This is important work. It's a public health crisis. The leading cause of death for African Americans between the age of 13 to 24 is gun violence. The leading cause of death for Caucasians between that same age of 13 to 24 is suicide. Please, pay attention. Our babies are dying. We have to stop it. That's my plea. And I also have a participant that want to speak.
Good afternoon.
Good afternoon. How y'all doing? It's my first time doing something like this. So since Andre came in my life been better. Took a turn for the better. Before he came in my life, I was dealing with death or jail. Since he came in my life, my whole life turned around. Can't really express too much what he do for me and my family and the love he showed me. But without him, I'd be dead or in jail. I can honestly say that. That's all.
Before you go, I just want to say thank you so much for coming to testify. And you said it was your first time, and I hope you know how important it is that you're here, that you share your story, and that you are fighting for others within your community, and you're making a big difference by being here. Thank you. All right, is anybody in the room here in opposition? Okay, thank you. I think we have somebody online, Dr. Heidi Apple. I think you're on mute, ma'am. Is it not working for you? Are you here? Do you want to tell me if you're here to, thumbs up if you're here to speak in support of the bill? Oh, here you are. There you go.
You guys hear me now? Okay, sorry about that. I don't know what was going on. I am here to support. Good afternoon, Madam Chair and members of the subcommittee. I'm Dr. Heidi Appel, a practicing pediatrician from Arlington, and I'm speaking on behalf of the American Academy of Pediatrics, and we strongly support this bill. Medicaid reimbursements for violence prevention services is an innovative tool for reducing violence in our communities. Many other states, including North Carolina and Maryland, have already implemented their own programs through CMS. Pediatricians play an important role in primary and secondary prevention for our children. It is critical that I provide information to my patients and their families on firearm safety and injury prevention. This is a public health issue, and this is an effective method for integrating violence prevention into our existing healthcare infrastructures. I want to thank the previous two speakers, and I want to thank you for your time, and we hope you will support this bill.
Thank you so much. I'm glad the technology worked out. Appreciate it. Okay, I think there's a question from Delegate Singh.
Thank you, Madam Chair. A few days ago in committee, we heard from the Department of Health and Human Services, and I don't recall a robust plan for addressing gun violence from that department. I didn't get a chance to comment on it or ask a question in committee, but I want to just reflect in the record that I do believe HHS, the department, should take a very strong stance on determining how we can address this problem. No parent should send their children to school and not know if their child is coming home, and I strongly support this bill. Thank you.
Thank you so much. Are there any other questions from committee members? Okay, so the appropriate motion for this bill would be to report and refer it to appropriations.
Move to report and refer to appropriations.
Second.
Madam Clerk, if you can please open the roll. Please vote on the board. Delegate Price, your bill passes to the full committee by a vote of 4-3.
Thank you, Madam Chair.
Thank you so much for being here. Delegate McClure.
Yes, Madam Chair. Which bill up for 1614?
Whichever you would like, whichever order you would like.
All right, I'll go with HB 1614, Madam Chair. Madam Chair, before I go into explaining my bill, I have 2 line amendments.
Okay, would you like to read them or would you like counsel to explain?
If counsel can explain.
Great.
Thank you, Madam Chair. As the delegate mentioned, there are 2 line amendments. The first line amendment is on line 240, and it increases the number of postpartum doula care visits from 4 to 6. The second amendment is again on line 240, and it changes the period of time during which doula care visits are provided after birth from 12 weeks to 12 months.
And Madam Chair, if I can explain those line amendments. So there was a drafting error in that when it was drafted by DLS, they wrote up what was already being done, but it hadn't been codified. And so we just wanted to make sure that we correctly reflect the intent of the bill, which is to increase the doula services from 4 to 6, and then also make sure that we extend it to 12 months, as it was explained by counsel.
Motion to move the amendments.
Second.
There's been a motion to move the amendments so that they're properly before us. All those in favor say aye. Aye. Any opposed? Great. Would you like to explain your bill now?
Yes, thank you, Madam Chair. Members of the subcommittee, HB 1614 increases the number of postpartum doula visits covered by Medicaid, again, from 4 to 6, and extends the period of time for utilizing those services from 6 to 12 months. Doulas are community-based individuals who offer a broad set of non-clinical pregnancy-related services based on continuous support to pregnant women throughout pregnancy and the postpartum period. Doula care not only supports the physical recovery of the mother, but also provides emotional support and breastfeeding assistance, strengthening the bond between a mother and a child, and by supporting mothers through this vulnerable period, we create healthier families and more resilient communities. 80% of pregnancy-related deaths are preventable. By expanding doula services in Medicaid, Virginia has the opportunity to lead the way in addressing the maternal health crisis by closing the gap in maternal health care. Doula care is evidence-based and has shown to improve health outcomes for mothers and babies, including reducing rates of postpartum depression, preterm births, and C-sections. DMAS actually conducted a study in 2020 which determined that doula services are a cost-effective approach at improving maternal and child health. While there is usually a cost associated with the benefit, there are also significant Medicaid savings to be had through those improved outcomes that could offset those costs and more. And so, Madam Chair, over 30% of Virginia counties lack essential maternity care, and that must change. And so, as a new mom to a 2-month-old, I am experiencing firsthand the importance of the emotional, physical, and informational support before, during, and after childbirth. I don't know where I would be without my doula, and so I just experienced this from firsthand, and I really appreciate bringing this forward to you all. This is part of the Virginia Momnibus, and doula care is a pathway to saving lives and building healthier communities. So, Madam Chair, members of the subcommittee, it is my hope that it's the will of the subcommittee to vote in favor of HB 1614.
Great, thank you so much. Are there any questions from our committee members about House Bill 1614? Are there any folks in the room in support of this bill? And I believe we also have some folks online. 1614.
Madam Chair, members of the subcommittee, Emily Moore, Voices for Virginia's Children. Delegate McClure explained it beautifully, so Voices strongly supports this bill and hope you will as well. Thank you.
Thank you. All right, are there any folks in the room who are here in opposition to this bill? All right, I don't see anybody. I'm going to call on the folks online. I'll start with, is it Nicole Wardlaw? I think we saw each other this morning when you came to testify.
Yes. Good afternoon. I'm Nicole Wardlaw, Dr. Nicole Wardlaw, certified nurse midwife serving in the Tidewater area. As a midwife, I work very closely with doulas, and I will say that during this time, insurances only cover maybe 8-10-minute visits, 1 to 2 postpartum visits, and 1 to 2 hours around delivery. And when our clients are discharged from our care, most of the time they are not seen until 6 weeks later. And during that time, there are challenges with breastfeeding, postpartum mood disorders, and also hypertensive disorders. This is the time when doulas who have a very close and intimate relationship with our clients can advocate for them, especially if they need to be seen again. We won't see them for 6 weeks, and sometimes we don't see them anymore after that. But when they have doulas and that expansion is possible, then they are also like a first line defense for us to bring them back into care when they need to be back into care. So I strongly support HB 1614 because if we have that expansion for Medicaid for postpartum care, doulas also need to be included in that because if not, we'll never turn the tide with these healthcare disparities. So I am grateful for that and thank you.
Thank you so much, Doctor. I think we next have Nataki Hill online. Nataki Hill, are you there?
I am. Greetings. I'm Natika Hill. I'm a doula, and I'm also representing, I'm doing postpartum right now for a client. And this baby is 4 months, but I'm also representing the Doula Association for Virginia, and we support this bill wholeheartedly because as Dr. Wardlaw stated, we are here. And so we can sound the alarm, and we do sound the alarm when clients are in trouble. They some of them have to go right back to work. And so them having to go back to work, take care of a baby that's waking up every 2 to 3 hours, trying to lactate, breastfeeding, is too much for them, but they don't know how to call out, don't know who to call out because they go see the doctors every 6 weeks, and we are there for them in the interim. And so I am in very much support of this bill. Thank you.
Thank you, and thank you for making time as you're giving care to also provide testimony.
You're welcome.
I think next we have Kenda Sutton L.
Good afternoon, Chair and members of the committee. I'm Kendra Suttonell. I'm the Executive Director of Birth in Color, and I'm also a doula. I also train doulas. Birth in Color is the largest doula organization in the state of Virginia, and we strongly support this bill. What we do know when we see across the state line, because we do cover the entire state, is that clients always need support. And what we do know is that the maternal deaths are the highest during the postpartum period. If they have a doula present, we're able to determine what signs that they need to ring the alarm and actually call their providers. We're able to catch certain things that sometimes their providers actually miss or feel like, okay, that's normal in certain situations. So when it comes to the postpartum, like we need to make sure that we're raising more awareness when it comes to maternal mental health as well, because what we do know is that postpartum depression actually peaks at day 120. And so currently we only have 4 visits, which is not nearly enough when you are a new mom and you're trying to say, hey, doula, I need you to come over. Don't understand the breastfeeding or lactation. And so we want to make sure that we have enough visits to make sure that we're covering all of our bases. And I'm strongly in support of this bill.
Great, thank you so much. And then we had one more person sign up. I just want to make sure that they're not online. Zena Brockman. Okay, I don't think I see them. All right. And I think those are all our witnesses. If we would like to move this bill forward, the appropriate motion would be still to report and refer to appropriations.
Move to report and refer to appropriations.
Second.
I'm sorry, I take that back. I'd like to move as amended to report and refer as amended to appropriations.
Moved as amended to report and refer to appropriations.
Second.
All right, thank you so much, Madam Clerk, for that assistance, and thank you for opening the roll. Everybody can vote. Okay, this bill will move to our full committee on Tuesday by a vote of 7-0. I think you have one more, Delegate McClure.
Thank you, Madam Chair. Madam Chair, I have an amendment for 1617 in the nature of a substitute. And the amendment simply removes health records from the list of vital documents included in the bill. And this was requested by the Department of Health.
All right, I think we need to move the substitute. Is it a substitute, Council? Yes, to move the substitute.
Second.
All those in favor, please say aye. Aye. Any opposed? Okay, the substitute is now properly before us. Delegate.
Yes, thank you, Madam Chair. So as mentioned, it's just to remove that health records portion, and they had mentioned that they can't regulate because any healthcare provider would be included in that. So just to explain my bill, HB 1617 would waive fees for homeless youth related to obtaining vital records such as birth certificates, driver's license, and state ID cards. And in 2022-2023 school year, Virginia's public schools identified nearly 20,000 students experiencing homelessness, which is an increase of 18.6% from the previous school year. And they also identified 455 unaccompanied youth who are homeless on their own without a parent or a guardian. And so I know from experience, having experienced youth homelessness, I actually didn't have access to my birth certificate until I was in college. And vital records are a necessary portion for homeless youth to access many education training, employment, food, housing, and other supportive programs. So, without that, they can't access mass transit. If they don't have access to mass transit, they can't access employment, and they need a driver's license because it's crucial to addressing those transportation challenges. And the homelessness status of these youth will be certified by the McKinney-Vento homeless liaisons, schools, social workers, counselors, and other homeless youth service providers. And so it's an effective way to ensure that the youth are connected with the people who most are qualified to help them complete that documentation and complete the waiver applications. And so many states have already adopted this type of legislation to waive those fees. That includes Arkansas, Florida, Alabama, Oklahoma, South Dakota, and it's been a bipartisan strategy to ensure that more young people are able to access those resources needed to thrive. So, Madam Chair, members of the subcommittee, I hope it's the will of the subcommittee to vote in favor of HB 1617.
Great, thank you so much. Are there questions from the committee? And I see Delegate Henson has his hand up.
Thank you, Madam Chair. I will just ask the delegate to re-explain the certification of how we're delineating homeless youth if they were to apply for their vital records.
Yes, and I thank the delegate for that question, Madam Chair. So again, as mentioned, the status will be certified through the homelessness liaisons, the providers, and the folks who are connected with the youth. So it'll go directly through those service providers.
Great, thank you so much. Are there any other questions from our committee? Okay, I see we have some folks getting lined up behind you, Delegate. Folks who are here to speak in support of the bill, please come on up.
Good afternoon, Madam Chair. Valerie LaRue from Virginia Poverty Law Center, and we support this bill. As the delegate mentioned, a lot of times youth in foster care have difficulty getting their documents, and they may need them before they turn 18, and they may not be able to afford the cost of copies. So this can be very important for them as they try to establish themselves in life. Thank you.
Thank you so much. Good afternoon.
Good afternoon, Madam Chair, members of the committee. Allison Gilbreth with Voices for Virginia's Children. I will echo the comments of Valerie of why we support the bill and urge the committee to do so as well. Thank you.
Hi.
Hi, good afternoon, Madam Chair, members of the committee. This is Wes Gibson with the Virginia Education Association. Our committee has voted in favor of this bill. We very much so support it. As the delegate mentions, we've seen a rise in youth homelessness, and we know that getting these records is going to be very important to youth being able to participate fully in school, and also, as they get older, be able to get to student programs. And so we really strongly support this bill and hope that the committee supports it as well. Thank you.
Thank you so much. Are there any folks here who would like to speak in opposition to this bill? Okay, so, all right, Delegate McClure, we were trying to figure out if we had discussed whether or not your bill needed to go also to transportation because that's a whole DMV section, and that's not covered by us, but Delegate O'Rourke suggests that we just go straight to approve, so, all right.
We got the money.
Okay, so the appropriate motion at this time would be to report and refer to appropriations. Sorry, as substituted. It's a little bit of a tongue twister.
Move to report and refer to appropriations as substituted.
Second.
Great. The motion is now properly before us to report and refer to as substituted to appropriations. Thank you so much. This bill has will be heard in full committee on Tuesday. But Mr. Rod had stepped out. I apologize. I did not call on our online members to participants to provide testimony. And I don't know if he's still there, or if he logged off. He's still there? Just want to give him a chance since he waited all afternoon. Hello, Mr. Montz. This bill just passed unanimously from our subcommittee, but I apologize I didn't call on you before we took a vote. I just wanted to give you a chance to just share your thoughts since you waited all afternoon.
Well, that's certainly good news. Good afternoon. My name is Rob Mons. Thank you, Chair Tran and honorable members of the subcommittee. I'm the Director of State Policy for an organization called Schoolhouse Connection. We're a national nonpartisan nonprofit that works to address youth homelessness. We've had an opportunity to work on bills similar to this in a number of other states. I'll just add, and Delegate McClure did a great job of addressing the issue, that this bill would allow Virginia to join about a half dozen other states that are working on similar legislation like this because of its importance as both an education driver and a workforce development driver. So we support 1617 and greatly appreciate the delegates' work on this and urge the committee to move it forward.
Great. Thank you so much, sir. I'm so glad that you were able to join us. All right. Thank you, Delegate McClure. We'll see you Tuesday.
Thank you, Madam Chair, members of the subcommittee.
Okay, I believe that concludes all the bills that were left on our agenda for today. Oh my gosh, Delegate Gardner, I apologize. I apologize because you're on the committee. Delegate Gardner's next with House Bill 1710. Would you like to speak from your chair? Of course.
Madam Chair, committee members, House Bill 1710 directs the Department of Medical Assistance Services to convene a work group of relevant stakeholders to address and make recommendations related to reimbursement rates for the federal early intervention program for infants and toddlers with disability. The Early Intervention Program provides services for infants and toddlers from birth until age 3 with developmental delays and disabilities. The legislation directs the work group to report its recommendations to the chairman of the House Committee on Health and Human Services, the Senate Committee on Education and Health by November 2025.
Thank you so much, Delegate Gardner. Are there any questions for the delegate? All right, are there any folks here to speak in support of this bill? Good afternoon.
Good afternoon, Madam Chair, members of the committee. Jennifer Faison, here representing the Virginia Association of Community Services Boards. Our CSBs serve as local lead agencies for these programs. And what we know is that every dollar you invest in early intervention will come back to you several times over, and we can serve these kids for less than it would cost to send a family of 4 to Disney World. So urge your support in this work group and study. Thank you.
Thank you so much. Good afternoon.
Good afternoon, Madam Chair, members of the subcommittee. I'm Katie Boyle with the Virginia Association of Counties. We also support this bill. I'd like to thank Delegate Gardner for her ongoing support for this very important program, which you just heard about the value from Ms. Faison, and we would associate ourselves with those comments. Thank you so much.
Thank you. Good afternoon.
Good afternoon. I'm Janet Arison with the Virginia Municipal League. We also support this bill and appreciate Delegate Gardner bringing it forward. Thanks.
Thank you. Are there any folks who are here to speak in opposition to this bill? All right, I don't see any. Before we make a motion, since it's been an afternoon about sharing lived experiences and how that impacts our policy making, I'm just really grateful to Delegate Gardner for taking this issue on. My youngest son participated in the Part C program, and we found the therapists that we encountered to be incredibly helpful, and early intervention is really key to helping our kids who are dealing with some of these issues. And so I really, really appreciate your leadership in this area. Delegate Orrock.
Yeah, Madam Chairman, I don't disagree with the concept. I guess my curiosity is why we need a work group versus just telling the department, seek the maximum reimbursement rate allowed under federal provisions with monies allocated by the Commonwealth.
Madam Chair?
Yes, Delegate Gardner.
I would say to the delegate that we just wanted to make sure that it didn't come back with a large fiscal impact because we did not know what that cost would be. And so it was really important to try to get it right so we could get this bill passed.
Thank you. Are there any other questions from our committee? Okay. So the motion on this bill would also be, the theme of the day is to report and refer to appropriations.
Move to report and refer to appropriations.
That motion has been made and is properly seconded, and I know Madam Clerk will soon open the rolls. You can close the roll, and that bill passes out of our subcommittee by a vote of 8-0. Delegate Gardner. All right, now I believe we are done for this afternoon, and we will see everyone next Thursday. Thank you so much.